everything that Fresh does in the North East and the wonderful results we've seen in the North East, which is a very deprived area in places. I just wanted to follow up on around the question on evidence and vape, and although there are still a few grey areas and unknowns about vapes, what we do know is that it is much less harmful than tobacco vaping, and crucially it's a really important tool for those people who do smoke. So what's the evidence that Fresh use to back up this argument, and do you feel that there could be a worry that if we focus too much in this bill on youth vaping, that we leave behind those very dependent, addicted and very often deprived smokers?
Thank you. So I think we're really fortunate in the UK, and the UK has shown great leadership in this by commissioning completely independent of government evidence-based reviews, and we've had 8 of those now since 2014. And I think that that's been incredibly important. Fresh is not complacent. Fresh has been monitoring the evidence around the rise in vaping and, you know, how this is positioned in terms of public health, you know, for the last 20 years since we were set up. And I would really strongly recommend that many of the questions, really useful questions that we've had today, can be answered actually from looking at those systematic reviews from the Office of Health Improvement and Disparities, in particular around when people are saying we don't know what's in vaping. There's a really significant chapter on what are the constituent chemicals, etc., in vaping and the magnitude of potential harm as such. I've forgotten the second bit of your question, Mary, sorry.
Well, it was about the use of vapes on those heavily dependent smokers.
Yes, so in the North East, vapes have been, quote, a game changer in terms of some of our heavily addicted smokers, and I have permission to share with you the fantastic role that they have played in our biggest mental health trust, Cumbria, Northumberland and Tyne and Wear. We're talking about people who have been smoking 40, 50 cigarettes a day for often decades, who have really, really struggled to ever imagine that they could get off lethal smoking. So being able to give them something that has given them still their nicotine, but in a much, much purer, safer, cleaner form, has been a game changer. Vapes are being used very successfully in our drug and alcohol treatment services, and on the point of alcohol as well, you know, the two often go hand in hand. And I would say to committee, if we are really intent to see an end to smoking, we must be doing more on alcohol. And wearing my balance hat, I think it's really important, balance is the alcohol bit, is we don't just think of risk-taking behaviour in youth as just vaping. So the World Health Organization last week published a report that shows the UK, sadly, across 44 countries, has the highest use of alcohol in 11-year-olds. Now, I don't think anyone can, I hope nobody thinks that it's okay, the amount of alcohol promotion, advertising and marketing and things as well. And I think it's just quite important that we do look at risk-taking behaviours in the round.
Thank you, Mr. Chairman. You've raised, in answer to my colleague Nicky Aitken, the primary issue in terms of age verification. But obviously we only get one of these opportunities to change the law in terms of tobacco and vaping once in every 10 years or so. So it's quite important that we get as much in there as we can. What other improvements would you like to see to the bill to strengthen the argument you're putting to get people to quit smoking or not even start in the first place?
That's a really good point, and I mean, I think it goes back to, you know, not wanting to delay the progress of the bill as such. I really do hope that, and it's not necessarily for legislation, but I think it is very important that we have a very clear communication strategy for this. And I think reflecting on previous legislation, much of the high levels of compliance we've seen in this country come from very proactive communications in advance of that. And I think we need to be really careful that the narrative doesn't get overly confused, because it worries me enormously, I will say, that too many people are staying on smoking because they are being scared of even trying to give switching over to a significantly less harmful product. And I do worry enormously around scaring. I think it's absolutely right that we have evidence-based messaging to children and young people, but they're messengers. They are messengers who go back to their parents. And we know that it's very important that, you know, they're sending clear messages back as well. So in terms of an additional amendment, I will defer that, sorry.
So can I just prompt you? I mean, obviously we've heard from the previous witnesses about licensing. We've talked about, I think the Minister has talked about warning messages in packs and also on individual cigarette papers.
Yes.
Would you support those sort of measures?
Yes. So I would absolutely support, and Fresh has been advocating for many years around tobacco licensing scheme. Whether it's within the parameters of this bill, I don't know, but I absolutely think it's wrong that anybody can basically set up out of their car boot and sell a lethal consumer product. I would also strongly recommend that previous consultations on things like pack inserts are looked at again. There's a very strong rationale for that. And also Canada now is leading the way in terms of very clear message on the cigarette stick itself and called dissuasive cigarettes. So certainly there are other things that are in that realm. And of course, I would also in the future be really willing to discuss the role of a polluter pays levy, because I do think that is something also worth considering.
5 minutes left, maybe 4 minutes in fact, and 3 people have already caught my eye. So short questions and short answers, please, colleagues. Thank you. Mary Glendon.
Ailsa, it's always great to see you, and your enthusiasm is showing through. We're very grateful for what you do in the North East with Fresh and Balanced. Perhaps just asking a little bit more about if this legislation is to be as successful as we all want it to be, does there need to be some kind of balance, no pun intended, between how education and enforcement can make this a successful campaign and bill to become enactable forward?
Thank you. Well, I think we've got a really good track record collaboratively over the last 2 decades of cross-party working and with fantastic support from civil society, from NHS and local authorities, and the previous legislation has gone through, really well overall, and it has been because we've worked together, we've built up public awareness, public support. I think it is absolutely important that we have the adequate resourcing for our really important professional groups such as trading standards and things as such. But I think it's about the communication, it's about the vision, it's about the narrative that we can set. And undoubtedly, I think if we can get this through, it's not just about stopping the start of that whole new generation, but we also know this will trigger many, many people thinking, you know what, I'm going to give it another go. I am going to try to quit. We know it can take people many, many times to quit for good. And that's why it's really good this is being backed up by the additional investment to the really important stop smoking support systems and also within our NHS trusts as well.
I heard this morning that some individuals and families, parents, had misinformation really about vaping. For instance, we were given the example that where flavours were grapefruit or fruity flavours that they might think that it's actually beneficial for children to be using them. Should we be doing more in terms of education in that sense to make sure that families are aware that because something has a fruit flavour on it, then it doesn't necessarily mean that it's it's good for their health, and also tackling those types of flavours as well.
So thank you. I mean, I note the aspects of the bill that are around flavours, and we absolutely think that more should be done on the descriptors, and we wholeheartedly agree that some of the description is completely inappropriate, but flavours do play a really important role, and particularly for example in our mental health trust, the fruit flavours have been the flavours that have successfully got addicted smokers off. I genuinely haven't heard that come up in the North East in terms of perceptions of parents thinking it's somehow healthy to have a fruit flavour to a young person. I think what is wrong though is if that's in a packet that's called unicorn, bubbly, shaky, whatever, with a cartoon image on it. That they are things that we should look at addressing. And interestingly, just in terms of vaping in the North East and in young people, a point I do want to make is I do think we need to be careful about the data. So we hear sometimes people saying all young people are vaping. The evidence does not stack that up. We have all of our local authorities do health behaviour questionnaires. Across the board it was around 10%. Which was occasionally vaping. Now, I'm not at all saying that we should be happy with that as such, but there is a risk by a public narrative that all young people are vaping is we inadvertently promote this as a norm as such.